Kenya's war against drugs is a puzzle where the pieces never quite seem to fit. It is a complex story of people entangled in the web of addiction, of law enforcement grappling with a slippery enemy, and of a society haunted by the collateral damage of a silent epidemic.
We must close all the loopholes and all the routes.
Kenya, it seems, is setting the stage for an intriguing experiment, daring to question the well-trodden path of punitive measures in a bid to change how the drug crisis in the country is addressed. An experiment built on the foundation of decriminalization, also known as drug amnesty.
An addict is actually a sick person.
It is a public health concern that must be dealt with.
Society is safer without drugs.
So will the script of drug policy flip, or will the familiar sense of prohibition persist? Against a backdrop of skyscrapers in Nairobi, Kenya's capital, lies a tragic underbelly. In these alleys, a different kind of hustle unfolds, not propelled by financial gains, but rather a clandestine pursuit of momentary bliss.
Mom, come back here too.
For 34 years, Andrew, not his real name, has chased the fleeting highs and enduring lows. An unpredictable journey that began in 1990 when he and his colleagues ran the streets of downtown Nairobi as bus conductors.
Staff kete moja itoka 25 bob. Na sisi tuko tu hapo hiyo mbele kakuwa madoni mingi na mabeste wangu wasianza kuingia hii kitu kama niko na 25 bob. Kwa hiyo tunatoa hata 30 tuko na kikete. Na siku ile kwa real shit. Once kete moja hivi tunaweza choma watu wawili na hata tushindwe kuimaliza na itatugonga, yani unasikia ni kama uko heaven juu cool, alafu kastim kapoa.
What started as a dare to complete a single dose of heroin evolved into a daily endeavor to keep his indulgence under 5 doses.
Janki hakuna kitu unaogopa kama withdrawal. Withdrawal ikushike mimi sasa mimi pande yangu nasema mimi niloko natanua hivi. Demo unavuta ndio demo ingia kwa blood. Sasa unapata dudoni mingi ya kulisha familia, pia kujisustain. Napata yani hata walitafika family we think sana.
This story isn't about the origin of Andrew's addiction. It is about the prospect of new drug policies touted to be the game changer for individuals like Andrew who are honestly striving for freedom from the clutches of drug addiction. According to a 2023 report by the National Authority for the Campaign Against Alcohol and Drug Abuse, NACADA, at least 26,000 people are said to be injecting hard drugs, a majority of them abusing heroin. An estimated 18,000 of them are from Mombasa County, with Nairobi and Kiambu counties following closely. Additionally, 234,855 persons are addicted to cannabis in the country, a majority of them aged between 25 to 35 years.
Because somebody is using it once a week or once a month does not necessarily mean they are not an addict. They are functional alcoholics, they are functional drug users or drug addicts who will use it periodically, get a good enough high to carry them through to the next high.
Bars will not have their licenses renewed.
We've seen Nakata doing a soup on people who are on this, changa. Then there is this smoke, which is a shisha. Yeah, we've seen them doing soups on that in bars and other places.
26 revelers who spent the night behind bars after they were arrested for selling and smoking shisha in Nairobi.
But I've not seen anybody in this country carry out a soup that we are looking for drug addicts. So the only solution will be give them amnesty and they'll come from where they are.
Dr. Robert Pukose is the chair of the Committee of Health in the Kenyan National Assembly, which plays a crucial role in overseeing health-related matters within the country. One key legislation the committee is considering is amnesty for drug addicts found in possession of drugs for personal use.
The environment within the jail might not be conducive enough for rehabilitation of this person. Yeah, and I don't think it is the best way out.
Like countless others grappling with addiction, Andrew found himself living for his next fix, carrying it with him wherever he went. The result, a jail sentence from 1998 to 2002 for heroin possession. This period, he admits, was the worst 4 years of his life.
The good thing, nikapata pia mabesti najua mtaa, au ndio pia wanajua nini nilikuwa natumia. Sasa ndio huko nao wamekaa wakaonyesha kama una do kuna tunza bai ikusaidie kwa withdrawals. Tumele pia anakuja kuonekana na anauza marufuku kwa mekaa. Kwa hivyo anauza bangi, anauza sigara, anauza pombe. Huyu ni mtaa na kweli sio kujifanya. Inabidi kate hii anachanganyisha na hiyo attain. Hakunywa ndio at least na mandomu nipate opportunity ya kukula. Na huyu hata dedi juu nilikuwa na dedi kweli wewe.
Artane, the drug Andrew is referring to, is a drug widely used to treat the symptoms of Parkinson's disease. It is also prescribed to manage movement disorders like stiffness or tremors caused by certain medications used to treat psychiatric conditions. Andrew claims that the Artane pills came from those who visited the prison or those who had prescriptions for it. Some time after Andrew's prison term ended, prison reforms were introduced by the then Home Affairs Minister Mudi Awori to emphasize more on reform than on punishment. Over the years, there have been other reforms, including the right to vote. But have this changed the experience for addicts arrested in the recent years?
Ni kugumu juu wengine hadi wanaassume hiyo ni starehe yako, hata hatuwezi shughulika ati venye utapata dawa yako. Nimejaribu kujiongea kwa madams, wananiambia sisi hatujui mambo yako. Siwe ndo ulijiingiza kwa hizo vitu, sisi hakuna wenye tulikusaidia, ni sisi tulikushika.
Najma, also not her real name, was arrested in early 2023 on a misdemeanor charge and sentenced to 8 months at the Langata Women's Prison. She was incarcerated with a 3-month-old child and says it took the intervention of an outreach counsellor for her to enroll in the methadone treatment program. Methadone is a synthetic opioid used to treat opioid dependence, particularly in those abusing heroin.
Nilikuwa napelekwa huko Madhari Hospital. Huko ndo station yangu ya kupata dawa.
According to John Ochola, an outreach officer and community paralegal in Nairobi, prison does not offer the best environment for recovering addicts, even though it may be the only way for them to start treatment.
Shida wako nayo sana huko ni lishe bora, wapati chakula ile kulingana na sababu ya hali yao. Wanakula chakula kama watu wa kawaida, sababu hilo pia tunapigania wapate chakula vizuri, waweze pia kaa vizuri.
Sahani yenye utapatiwa hiyo ndo bahati yako. Unaweza pata umepatiwa sahani iko na matawi ya kabeji na iko na maji. Ukiendea kwa ugali, upate hujapata ugali, umepata ile kitu ya chini. Sasa iwezi kusaidia.
While the amnesty proposal may not apply for addicts charged with other crimes, as is the case with Najma, the question here is what the criminalization of drug possession, even without the intent to distribute, as in Andrew's case, will mean.
What it will mean is that we'll have to amend that act. It is different from somebody who is engaging in trade. And for personal use might not be huge quantities, might not be quantities of commercial nature. Once you subject it to public participation, people will say maybe up to this level.
The Narcotics, Drugs and Psychotropic Substances Control Amendment Act of 2022 is what Honorable Dr. Pukose is referring to. As per the Act, in respect of cannabis, for example, where the person satisfies the court that the cannabis was intended solely for their own consumption, the person will be sentenced to imprisonment for a term not more than 5 years or fined not more than 100,000 shillings. Additionally, in respect of a narcotic drug or psychotropic substance other than cannabis, where a person is in possession of less than 1 gram, the person will be fined not less than 5 million shillings or subjected to an imprisonment to a term of not less than 5 years or to both such fine and imprisonment.
So the law presently in Kenya, the criminal justice system does not have different legal liability or criminal liability in terms of responsibility between users and peddlers or traffickers. But the differentiation comes in at the punishment level.
The discussion around decriminalization of drugs and drug amnesty isn't a new thing. Here's an example. In 2001, Portugal, once known as the heroin capital of Europe, decriminalized the public and private use, acquisition and possession of all illegal drugs as long as they do not exceed the amount required for an average individual's use for 10 days. As a result, drug use became a misdemeanor but not a felony. Rather than being arrested, those caught with a personal supply will be given a warning, a small fine, or told to appear before a local commission comprised of a doctor, lawyer, and a social worker to forge a way forward regarding treatment, harm reduction, and the support services that were available to them. The policy focused on harm reduction rather than criminal prosecution, with addiction treatment and needle exchanges eventually contributing to a decline in overdose deaths and HIV transmission through drug injections. Portugal's relative success has now seen countries like Canada commit to similar programs. Canada only allows possession for opioids for up to 2.5 grams for those over 18 years of age. Its initial trials are in British Columbia, an experiment that began in January 2023 and is set to continue until January 2026.
As of today, as we speak, there's no evidence that putting people in jail will reduce drug use in any country of the world. As we speak today, there's no country that has ever arrested its way out of drug problem.
Africa hasn't been left out of the discussion. In 2019, a model drug law for West Africa was presented to Ministers of Health of the Economic Community of West African States, ECOWAS. West Africa is recognized as a major transit hub for illicit drugs. Part of the provisions in the document include, and I quote, "Notwithstanding any other provision of law, the unauthorized possession, purchase and transportation of controlled drugs for personal use do not amount to an offense in law." It also states, I quote, "A person who publicly incites or induces others by any means to use drugs for unauthorized purposes commits an offense." So far, Ghana has introduced a wide range of reforms in its Narcotics Control Commission Act 2020 that converts prison terms for personal drug possession into non-custodial alternatives, including financial penalties. However, if the penalty isn't paid, then a term of not more than 15-month jail term will automatically be given.
I don't think imprisonment will be a deterrent enough for this person to stop taking those drugs. When we talk of people even with guns, an amnesty normally comes in and you'll find that people surrender.
Mohammed Merali, a consultant psychologist at the Aga Khan University, admits that such a law will create a significant impact among substance users if well-thought-out investments are made. He adds that most drug users begin using drugs as a coping mechanism, and addressing this issue needs those underlying issues to be addressed as well.
So if we criminalize a drug user, they're not going to come forward. And so decriminalizing it is probably an angle to consider with its sensitivities that are attached to it. You know, there are real issues that are difficult to deal with when you want to decriminalize drug use or suicide, for example, because doesn't that legalize it? So even those who are using it in moderation can come out of the box and say, it's free for all.
According to Kenya's drug regulation law, the court is empowered where it deems fit to commit persons to appointed treatment programs or to voluntary submission to a rehabilitation program for a period not less than 6 months, in addition to the punishment prescribed.
There are very many persons who are the court orders to rehabilitation in government institutions like the Madare Mental or the Madare Rehabilitation Center.
In such rehabilitation centers, methadone, an orally dispensed drug, is used for treatment. The drug, taken once a day by recovering addicts, reduces cravings for other opioid drugs and prevents a patient from experiencing withdrawal symptoms. It was introduced in Kenya in 2014 as part of the policy initiatives aimed at curbing the spread of HIV among injecting drug users. Based on the latest statistics by the National AIDS and STI Program NASCOP, there are 11 facilities in the country where methadone is issued. These include 2 clinics in Nairobi, 3 in Kiambu County, 2 in Lamu County, and 1 each in the counties of Kisumu, Mombasa, Kwale, and Kilifi. By the end of December 2023, based on the same statistics, there were a total of 6,039 clients on methadone in the 11 medically assisted therapy clinics across the country.
So what happens to the rest of the people? So we must have a health infrastructure that is inclusive, that has sections open for those who are struggling with addiction so that they can access the health services and healthcare that they need at any time.
Chris Obor is the executive director at Kuza Trust, an organization at the forefront of protecting and promoting the health and human rights of people with intersectional vulnerabilities. His perspective is that trafficking and addiction, while linked, should be treated differently.
The government has a responsibility to make sure that the issue of drug trafficking is dealt with. What we want to separate is drug trafficking and drug addiction.
The possibility of Kenya taking the amnesty route came after a benchmarking visit in Mauritius by members of the National Assembly's Health Committee and a parliamentary caucus against drug abuse in November 2023. The visit, sponsored by the United States Agency for International Development USAID, was for Kenya and Mauritius to exchange best practices in drug abuse management.
They have a progressive legislation which is in place, and this was chosen as a country that has done very well in terms of managing drug abuse.
According to Dr. Pukose, Mauritius extensively funds rehabilitation, treating drug abuse as a chronic mental health condition. Their approach, which includes budget allocation for treatment, differs significantly from Kenya's heavily privatized addiction rehabilitation services.
In the 6 counties, we only have 2 public rehabilitation centers. Miritini Treatment and Rehabilitation Center in Mombasa, which is run by Nakada, and the Kwale County Government Rehabilitation Center in Kombani. This is against 14 private facilities, charging from 90,000 Kenya shillings or more for a 3-month program. This is not affordable to most families.
The need for rehabilitation centers across the country, Nakada says, could be met if specific provisions within the country's drug law are implemented.
We have proposed that a rehabilitation fund that's actually proposed was proposed in the 1994 Act, but it has never been implemented to date. The rehabilitation fund, into which even proceeds of crime related to drugs will be plowed and therefore generate a resource base for rehabilitation programs.
As the National Assembly Health Committee ponders over its next move regarding the proposal, like what should be considered first or what specific details it will entail before the proposal is presented to the public, civil society organizations like Kuza Trust are pushing for all county governments to be proactive in the drug abuse discussion.
It is important to have a national law that entrench harm reduction, and also equally important to have laws at the sub-national level, that all the counties need to have harm reduction laws or guiding frameworks to make sure that those people who struggle with addiction are protected, appreciated, and actually included.
Harm reduction, as per the World Health Organization, is a set of activities intended to minimize the negative physical and social impacts related to drug use, such as the transmission of HIV, criminal activity, and drug-related deaths. These activities include providing drug users with access to sterile needles and syringes, access to methadone or opioid substitution treatment for eligible opiate users, HIV testing and counseling, diagnosis and treatment of viral hepatitis, among others.
I note that Mombasa County is making progress in developing a legal framework. As I urge the county to expedite this process, I encourage the other governors and county governments to adopt a legal framework to complement national laws in providing a structured approach to defeating drugs.
Sisi kama serikali ya kaunti, wale wenye kutumia madawa ya kulevya wote tuliwafanyia mpango tukawawekea NHIF. Sisi kama serikali ya kaunti tukaendelea zaidi, na sasa hivi tunatengeza rehabilitation center.
The government and the civil society has to strive to create an enabling legal environment to expand the harm reduction services that exist and also move it towards integration and resocialization.
At the moment, Najma is on methadone, but Andrew is still actively using heroin. They and others with experience using heroin understand that getting and staying clean requires a great deal of commitment if they are to live better lives.
Mimi nilianza staff nikiwa let's say 18, 19 years. At this time, niko 48 years, 50. Angalia pale niko. Nilikuwa shikado. Hii itafanya trust yako na kila mtu toka familia yako, kila mtu iishe. Yaani kila mtu atakukunaga wewe ni adui.
Na siwezi taka mtoto wa mtu atumie. Yaani ni kama kuwa umebeba kifo na mgongo yako.
For Nakada, protecting the society from accessing drugs remains at the core of their agenda.
The society is safer without drugs than with treating kindly people who have used and addicted to drugs.
What will this mean for drug regulation policies in Kenya? What will the drug amnesty policy look like? Addressing substance abuse needs to include pathways to access treatment, counseling, and support services. The system, as it currently exists, focuses on punishment as a deterrent. But perhaps it is time for Kenya to rethink how it treats addiction.